Hello, I'd like to start off with the definition of biopsychosocial. Biopsychosocial is the approach that considers the interactions between biological, psychological, and social factors in the understanding of one's health and illness. It recognizes that health outcomes are influenced by one's genetics, their current mental health, and the socio-environmental factors that they go through on a daily basis. My mock client is John Smith. He is a 22-year-old single homosexual Caucasian biological male. He does identify as a male. He lives with his married parents, middle class home. He is a single child and college student, and he currently holds a part time job in a coffee shop. Mr. Smith has always shared his sexuality with his friends and his community, and he's never had a problem with that. He's never displayed an outward stress uh, for that. He fears and he has fear and anxiety because he has not shared this with his parents yet, and he has made the decision to do so. So, this building depression and anxiety in the beginning of treatment has brought him to therapy because he himself wants to learn a way to treat that. After a month of care, his anxiety and depression, irritability, and hopelessness, combined with sleep disturbances and consistent rumination, has led him to begin suicidal ideations. Mr. Smith was physically healthy and had no prior medical conditions when he entered treatment, but he has developed a self-reported heavy marijuana and alcohol use, which didn't exist before when treatment began. He no longer attends class and he no longer goes to work. He's hid this from his family, though. His mother and father are not aware of this currently. When he first came into care, to therapy, his original diagnosis was adjustment disorder with mixed anxiety and depressed mood. But over this time, it has developed into severe recurrent episodes of major depressive disorder. Because of this, the appropriate screening assessments that would be used is the Ask Suicide screening questions, the Beck Depression Inventory, the Screening Brief Intervention and Referral to Treatment, and once again, the beginning of this treatment, and it will go on. It will be done again. Is the generalized anxiety disorder to recognize the increase of his feelings of anxiety. Because of the suicidal ideations, the immediate treatment would be trauma-informed care, intervention slash risk environment assessment. We'd have to contact his friend, his friend's group, parents. They must be aware at this point, and referral to a psychiatrist because possible meds may help calm his feelings and allow him to lessen his anxiety and depression. Therapies, cognitive behavior therapy, help him approach and change his unhelpful thought patterns. And humanistic therapy, it's a holistic approach. It will emphasize his personal growth and help him acceptance. and remind him of the inherent goodness that he has. Possible medications: SSRIs, Celexa, Lexapro, Zoloft; SNRIs, possible Cymbalta, Effexor, and Pristiq; or diazepines, uh, Klonopin, Valium, or Xanax. His treatment plan, the goal of his treatment plan, would be to help the factors he's expressed in 30 days. He should create a daily journal to track his anxiety. He has to maintain self-care, create a positive time for himself, and do his best to slowly return to being active with his friendships and his schoolwork, and possibly his current job would understand this and allow him to continue to work there. That's between the therapist and him. A safety plan must be created as well. Local emergency numbers will be provided. Uh, Family and friends and out of area contacts all should become a part of this plan, so he has somebody to reach out to. Mr. Smith's goals and interventions: he needs to identify his addictive behaviors. He needs to set goals and objectives for his success. And Mr. Smith needs to envision the desired outcomes of his therapeutic journey. Addictive behaviors is defined by one's cravings, putting themselves in risky situations, social avoidance, substance abuse, and compulsive worrying. Somebody that is addicted to a substance makes impulsive actions. They become addicted to anger and self-harm. Co-occurring disorders Mr. Smith may have is major depressive disorder. It often coexists with anxiety and substance use disorders. Multicultural issues of concern Mr. Smith faces is discrimination, judgment from others and himself due to his sexuality, stressful experiences that others don't face may occur, and he may have underlying problems with identifying himself and his behavior. There are many providers in the community that can help those who are suffering issues like what he's going through, and that can be the Ken Community Health Center in St. Petersburg, Florida, the Community Foundation of Tampa Bay, the Empath Mid-County Community Service Center, and the local college, the USF Pride Alliance. The addresses are listed below. It is most important to continue education as a therapist, and there are many opportunities. There's cognitive behavioral therapy training to help better understand the process, advanced treatment of depression and mood, and CBT basics to understand anxiety and personality disorders. Thank you so much.